Swastiastu. Hello everyone, my name is Huliana Lim. I'm the representative of Student Group Discussion B8 Udayana Medical School. In this occasion, we will going to present our student project of this musculoskeletal block with the given topic, open fracture. Okay, next page. And this is our group member. And the presentation will be continued by my friend. Thank you.
Hello everyone, my name is Natasya Pusparani with a 3-digit number of 227, and here I will be presenting about the background of our paper. So open fracture is an injury where there is direct contact of the fracture site or its hematoma with external environment via exposure of a traumatic break of the skin and soft tissue. Most of the time, the wound on the skin may not be directly over the fractured bones. Thus, any fracture with corresponding wounds would still be considered as an open fracture until proven differently. Approximately 1 in every 120 people under the age of 65 years may experience fracture, and about 3% of these incidents are open fractures. The severity of the trauma varies with the energy applied during the fracturing process, which corresponds to its length of healing process and the complications that may occur. Open fractures may lead to risks for amputation, non-unions, delayed unions, and since the fracture site is exposed to an external environment, if not properly treated, then infection would occur. This poses as a higher threat and challenge for surgery. There had been several advancements on how to properly manage an open fracture, but the main purpose remains the same. It is to prevent infection from occurring. Back in history, the infection would usually lead to sepsis, amputation, and even death. But then in the early 20th century, surgeons began to introduce appropriate debridement. However, at this point, they did not consider usage of antibiotics because they thought that it might cause rise for resistant organisms. However, in the current period, it has evolved and evaluated specific antibiotics to be used for open fracture as well as an improved surgical debridement.
Thank you for the chance. My name is Krishna Putra Pramanda with the number 128. So now I would like to continue this presentation about the problem formulations. First of all, what is the etiology of open fractures? What is the pathophysiology of open fractures? How is the classification of open fractures? How to diagnose open fractures? How is the treatment or management available for patient with open fractures? And then the last one, what complication can occur in the patient with open fractures? Next. After that, I would like to continue the presentation about the learning objective of our student project. First of all, to understand the etiology of open fractures, to understand the pathophysiology of open fractures, to know the classification of open fractures, to know how to diagnose open fractures, to find out the right treatment or management available for open fracture sufferers, and then the last one, to find out the complication that can occur in the patient with open fractures. Next. And then the last one, I would like to tell you about the benefits of our student project. First of all, to medical students to complete knowledge of open fractures, to scientific learning, to learn more about open fractures and know how to treat it. And then the last one for community, to increase knowledge in community who have a better understanding of open fracture, and then the appropriate therapy for it. I think that's all from me. This presentation will be continued by my friend. Thank you.
Good morning, evaluator. I would like to introduce myself first. I'm Annisa Nuraini with the last 3 digits of NIM 110. I would like to continue the presentation on etiology of open fracture. So what is an open fracture? It is a fracture with an opening of wound near the fractured bone site, which allows the exposure of the fractured bone and also its hematoma to the outside environment, which cause a higher risk of infection because of the surrounding soft tissue damage and also possible bacteria contamination. It can happen secondary to trauma as a result of an injury. They could also occur as a high energy injury, with most common cases are related to traffic accidents and even falls from a great height. They can also be caused by the piercing of broken bone through the skin and soft tissue due to a low energy trauma, often caused by torsional injury during sports. The severity of the trauma and open fracture depends on the level of energy involved in the mechanism of injury. It is considered an orthopedic emergency because they are often associated with other life-threatening conditions and could also pose other risks such as soft tissue crushing, wound contamination, neurovascular injuries, and also skin degloving. It is highly possible for these conditions to make them more likely to have complications. If an open fracture is not treated properly, it can lead to malunion, non-union, and even long-term morbidity and also disability. Well, that's all that I could explain. Thank you.
Hello everybody, in this opportunity, I would like to explain the pathophysiology of open fracture. First of all, let me introduce myself. My name is Putra Yoga and my student identification number is 20025111084. Okay, so let's start it. A fracture is open when there is a direct communication between the fracture site and the external environment. This is most often through the skin. Fracture may become open by either an in-to-out injury, whereby the sharp bone ends penetrate the skin from beneath, or an out-to-in injury, whereby high-energy injury penetrates the skin, traumatizing the subtending soft tissue and bone, such as ballistic injury or a direct blow. Whilst any fracture can become open, the most common fractures are tibial, phalangeal, forearm, ankle, and metacarpal. So this is the diagram of pathophysiology of open fracture. When a traumatic injury occurs, bones and soft tissue absorb the imposed energy. It is when the threshold of absorption is exceeded that communication of the bone occurs, causing periosteal stripping and soft tissue destruction. The comminuted bone fragments are often not attached to any anchoring structure, which allow them to be displaced, causing significant soft tissue and neurovascular structure damage. When the skin tears, it creates a vacuum effect, which then pulls all surrounding debris into the wound. Okay, so that's all the pathophysiology of open fracture. The presentation will be continued with my friends. Thank you.
Hello, my name is Luh Wina Saraswati with the last 3 digits of student ID number 142. Now I will explain about the classification of open fracture. The most used system for classifying open fracture is the Gustilo-Anderson classification. In this Gustilo-Anderson classification, it doesn't only provide a prognostic framework that aids in treatment, but also aids the communication of scientists, also assists in refining surgical protocols, change antibiotic recommendation, and assist in timing appropriate intervention such as debridement, internal fixation, and coverage from soft tissue. In Gustilo-Anderson classification, they are grouped based on wound size, level of contamination, and bone injury into 3 categories. Type 1 is an open fracture with a wound length of less than 1 cm and clean. For the type 2 is an open fracture with a laceration of more than 1 cm without extensive soft tissue damage, flap, or avulsion. That's all from me. For the other type will be continued by my friend. Thank you.
Hello everyone, my name is Angelyne Nevrita Mulia with last digit number 051. So next I will explain about the type 3 open fractures. Type 3 is classified as either an open fracture with extensive soft tissue damage or a segmental fracture or traumatic amputation. In type 3, there are special categories such as gunshot injuries, any open fracture due to farm injury, and any open fracture accompanied by vascular injury needing repair. Based on the severity of the soft tissue injury, requirement for vascular reconstruction, and worsening prognosis, type 3 is subclassified into type 3A, 3B, and 3C. Type 3A is open fracture with adequate soft tissue coverage of a fractured bone in despite of wide soft tissue laceration or flaps, or high energy trauma regardless of the size of the wound. Type 3B is open fractures with extensive soft tissue injury with periosteal stripping and bone exposure and typically related to massive contamination, while type 3C is open fracture that associated with arterial injury needing repair.
Hello everyone, my name is Gloria with the last 3 digit number 162, and I'm going to present about the diagnostic imaging. So to confirm the fracture, there are several diagnostic imaging tools, and I'm going to explain about the X-ray, computed tomography scan or CT scan, and magnetic resonance imaging, MRI. So plain radiographs or X-ray can detect loose bony pieces and other bone diseases, including compression fracture or osteoporosis of the bone. Through X-ray, the healing process of the fracture can be assessed, including callus formation, elimination of fracture line, and other fracture union process. Next is CT scan, which provides more information of the bone and the involvement of the surrounding structure, including soft tissue injury and abnormal lesions, which are indistinct if viewed by plain radiographs. Matrix mineralization, destruction, cortical scalloping, periosteal reaction, calcification, and ossification can also be visualized clearly by CT scan. Lastly is MRI. These tools gives an intense dimensional resolution. Soft tissue could be differentiated more clearly, and it also lacks ionizing radiation. usually tendinous, ligamentous, intra-articular structures, and intramedullary injury are seen over MRI. The information could also determine the surgical planning, local tumor staging, and assessment of chemotherapeutic effect. That's all from me. The next presentation will be continued by my friend. Thank you.
Okay, thank you. Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Okay, now I'll explain about the initial management of open fracture. Number one is primary survey. According to Advanced Trauma Life Support or ATLS protocol, the patient's airway, breathing, and circulation status should be analyzed first, and then the resuscitation can be done if the patient needs it. Number two is anamnesis or taking history. This should be addressed in order to determine the mechanism of injury and the circumstances surrounding the injury. Also, taking history of medical and surgical, including the medication and allergy. Number three is physical examination. This can be done from head to toe, including the precise examination of the injury, including the bone, skin, soft tissue, infection rates of the injury, and neurovascular injury. Next is administration of antibiotics and tetanus prophylaxis. It's determined by the classification of open fracture. Type 1 and type 2 fractures have the risk of gram-positive infection, so cephalosporin is recommended to be prescribed. And then the type 3 fractures commonly have the high risk of contamination with gram-negative bacteria and anaerobic bacteria due to soil-contaminated injury. And the antibiotic choice of type 3 fracture are piperacillin, ceftriaxone, cefazolin, tobramycin, and penicillin. Okay, number 5 is initial debridement. This initial debridement and irrigation of open wounds can be done at hospital bed to remove the accessible contaminants for reduce the risk of the infection. Okay, I think that's it for the initial management. Thank you. Next.
Hello, my name is Gede Raka Samudra, number 023. Now I will explain you about the surgical management. One is debridement and lavage. Debridement and lavage are involved in surgical management of open fractures. These managements require in open fracture surgery with bone and soft tissue reformation. The purposes of the surgery include wound debridement is to remove some non-viable or necrotic tissues and sequestrum, and perfusive wound lavage to decrease the affected area or inoculum. Number 2 is open reduction internal fixation or ORIF. Open reduction internal fixation is a surgical procedure that reconstructs fractures by using metal, such as pins, rods, and screws. Indications for ORIF of fractures such as unstable and displaced fractures, delayed union fracture, pathological fracture, etc. Contraindications to ORIF, such as severe neurovascular inadequacy, open fractures with soft tissue destruction, and high gross contamination. Number 3 is open reduction external fixation, or OREF. Open reduction external fixation is a surgical procedure that unites and stabilizes fracture and demits soft tissue by inserting a pin through skin into the bone, then restrain it with an external frame. There are indications for OREF of fractures, such as fracture with severe damaged soft tissue, infected fracture, and joint fracture. That's all from me. Thank you.
Hello, my name is Azza Alfadhil with digit student ID number 094. I will explain about the pharmacological management of open fractures. Open fractures are prone to contamination and should be treated to prevent the risk of infection. In this case, antibiotics should be given immediately at pre-hospital or emergency department. Type 1 and type 2 open fractures, there is a tendency for infection by gram-positive bacteria. Cephalosporin, such as cefazolin or cefuroxime, are usually recommended. In addition, gram-negative bacterial infection should be considered in type 3 open fractures. Gentamicin, which is an aminoglycoside antibiotics, is usually used in this case. In case of farm injury and possible of clostridial infection, patients should also be given high dose of penicillin. Clindamycin can be used as a substitute if patient is allergic to penicillin. If the patient has no history of tetanus booster in the past 10 years, the patient should be given a tetanus toxoid and tetanus globulin. The duration of antibiotics in this case of open fracture is between 1 to 3 days. Even so, the use of antibiotics is often maintained until the wound is closed. That's all for me. Next.
Hello everyone, my name is Bagus Ugrasena. My ID number is 2025-1184. So today I'm talking about the complication of an open fracture. So in some cases of fracture, there's another few complications as a result of the fracture. Fracture complication is divided into two types. Early complication, which means complication occur a few days after the trauma. And the other one is late complication, which means a complication occur a couple of weeks after the trauma, such as delay onion, mal-onion, and non-onion. So, however, in the cases of the open fracture, the most commonly early complication is vascular injury, nerve injury, infections, and compartment syndrome. Compartment syndrome means a condition in which increased pressure within the closed myofascial compartment can lead to decreased tissue supervision. Complication with infection can come from normal flora around the skin, and it can also come from the pathogenic bacteria, especially gram-negative bacteria. Group of normal skin flora such as Staphylococcus, Phyrophionibacteria acne micrococcus, and the complication of open fracture with the bone infection can make bone healing difficult, as well as the new problem as a bleeding, septic shock, chronic osteomyelitis, and tetanus. Next.
Morning, Doctor. My name is Felix with last digit of student ID 099. I will continue the presentation regarding the conclusion. So first, open fracture. Open fracture is an opening wound near the fractured bone site, which allows the exposure between the bone and its hematome to the external environment. Open fracture are considered as an orthopedic emergency, as they are often associated with other life-threatening conditions. The pathophysiology of open fracture occurs when the absorption threshold of the bone is surpassed the limit, resulting in bone breaking into multiple fragments, periosteal stripping, and soft tissue devastation. Multiple bone fragments reach into the skin and rips the skin and expose the bone, so it might cause the infection. So the most used classification for the classifying open fracture is Gus Anderson, which classified bone fracture into three categories based on wound size, level of contamination, and bone injury. The open fracture is diagnosed by with the help of X-ray, CT scan, and MRE. The main aims of open fracture management include the management of the advanced trauma life support, debridement and lavage, reduction and fixation, antibiotics. If the management of open fracture isn't fully optimized, the open fracture could lead to several complications, such as vascular injury, nerve injury, infection, and compartment syndrome. So next.
The conclusion wraps up our student project presentation. These are our references. That's all from us. Thank you for your attention. Om Santi 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 Om.